Good evening, everyone. As you all know, my name is Farzana, and my purpose tonight is to bring to your awareness the maldistribution of physicians in the United States and to persuade you to support legislations which address this issue. Now, extensive research has focused on modeling the distribution of doctors over time, and I'm particularly interested in this area. As an undergraduate research scholar, I spent the last 8 months trying to model the distribution of physicians in our country based on data from the Centers for Medicaid and Medicare, the United States Census Bureau, and the United States Department of Agriculture. Just some background into the issue. Since the 1960s, federal government has been attempting to influence the distribution of our doctors. However, the doctors can go freely. They can move wherever they want to. And this has led to a large disparity between where doctors locate themselves and the actual needs of the population. The American Medical Association has mentioned that this disparity has caused a number of areas to become underserved and other areas are receiving excessive care. So what does this have to do with you, my audience? You or your loved ones may be living in an underserved area. Now, as concerned citizens, if we support the legislations that are in place right now to address the maldistribution of physicians, we can actually increase medical care in underserved areas. So my agenda for tonight, I use the problem cause solution method, and I'll be going through in this order. So the problem. The American Medical Association has specifically mentioned that some areas have a 50% surplus of physicians, while others have a 10% deficit. What they also found is that 33% of our doctors are concentrated in 4 states, including California, New York, Texas, and Florida. Fordyce and his colleagues mentioned in research that 88% of our physicians are practicing in urban areas, while a meager 11.4% are practicing in rural areas. Now, my research actually focused on these numbers, and what I found was very intriguing. Based on the data that I had, I found that 99.5% of our physicians are actually practicing in urban areas. The numbers that you see highlighted in red, 0.19 and 0.27, are meager 0.4% of physicians that are practicing in rural areas. Now, if you look over to my chart, I couldn't get this to go on the PowerPoint because it was so big, but the lighter areas of green represent the areas that are rural. So if you had watched this map fill in itself, these were actually our urban areas, darker green, and if you look as the lighter shaded areas, those are our rural counties. But this is not enough. We must look at some other numbers. When I examined the number of physicians in terms of counties, I found that the 10 counties with the highest number of physicians were all urban areas. On the other end, the 10 counties with the lowest number of physicians, 6 of those counties were rural counties, and moreover, 4 of them were isolated areas. So that's important to know. As I mentioned to you in our previous study and my previous presentation, is that we must not just look at mere numbers. We must look at the population size versus the number of physicians in that area. What I found in terms of the 10 counties with the highest number of physicians per 100,000 is that those 10 counties, all of them were urban. What was very interesting that I found in my research, though, is that in terms of 10 counties with the lowest number of physicians per 100,000, 7, which the ones are highlighted in orange, those counties, anybody wants to guess something about these counties? If you know anything about counties in general? No?
Guerrero?
No.
Low population.
All 7 of these counties were urban. And this is a great indication that not only are our rural areas being underserved, but our urban areas have an issue as well. Now that we've examined the problem, let us look at some of the causes of this maldistribution of doctors. Now, there are a number of factors that can affect the distribution. Plenty. I can't go through them tonight, but I will focus on the socioeconomic conditions. So Ricketts and Randolph in their study mentioned that particular socioeconomic factors like unemployment, physician concentration, and income per capita are very important in terms of looking at distribution. I used a similar model in my research, and what I found is that health insurance, income, unemployment, and minority population are very significant in terms of affecting the physician per 100,000. Just to go through a few of these numbers, when the population under 18 without health insurance increased by 1%, the doctors in that area decreased by 18 per 100,000. That's a big number. Moreover, with income, as income increased by 1,000, we had our doctors increasing by 3.2. Similarly, with regard to our unemployment, if unemployment increased, our doctors decreased. With our minority population, the doctors increased in those areas with a 1% increase in minority populations. But if you take a look at these numbers, per 100,000, that's just one doctor per every 100,000 for an increase in minority population. Now that we've had a general understanding in terms of the imbalance of our doctors, let's look at some of the solutions. Now, I've mentioned to you that federal government has been trying to influence the distribution of doctors and so forth. In 1987 and 2003, they've had specific Medicare reimbursement programs, and what these programs really do is that they increase payments for those doctors who decide to go to underserved or rural areas. And as we all know, the Affordable Care Act is on its way, and I've mentioned to you before that there are specific provisions in that act that are going to address the distribution of our doctors. But these provisions are underway, and my suggestion to solving or helping to solve this problem lies in you, my audience. You. I would like to persuade you to take action, take a proactive move. Try to influence your friends, your family that are budding physicians. Tell them that there's so many benefits for them if they work in underserved areas. You know, as I mentioned, doctors get more reimbursements now if they work in an underserved area or a rural area, and this can only help the situation. We have so many underserved areas. We're a first world country, and it's sad that many people are lacking basic care. To recap, we went over the problem, the maldistribution of doctors in the United States. We went over the socioeconomic characteristics, health insurance, unemployment, minority populations that are important to the maldistribution of physicians. And finally, we've looked at the federal legislation. And again, I urge you to take action, encourage, spread the word, let everyone know that yes, there are provisions in place for those doctors who have their heart out for people that are underserved. Thank you. Any questions?
Yeah.
Sure.
Do you think that it would be possible to put a mandatory move or a mandatory stop on doctors coming into, you know, if there's too many doctors in one specific location, if they can be like, hey, you know, we don't need like us like not hiring as many or offering some more incentives to doctors to move out to more rural areas?
Yes, I definitely think so, because right now the real issue is that doctors, even though they have all these federal laws in place, doctors can still go where they want to. But if you put like a barrier, like okay, this area, like this probably lies in the state, the federal government is not going to do it. So maybe it lies within the state boards to actually come up with such a policy, and I think that would really help. Like, you know, we've decided that yes, we've had enough doctors, and it's time we don't need to hire any more in this area.